Good evening to all. Today's 38th medical term is known as saccade. Sounds a strange word, but it's all about eye movement. Rapid, simultaneous, ballistic eye movement. Of course, not a ballroom, right? But it's a ballistic eye movement. So, what is the purpose of this movement? It allows the eyes to shift gaze from one point to another. It seems that we generally do this, isn't it? I mean, we are just looking at something, or we are just sitting and we point at one particular person or a particular place, and then suddenly we shift. And this particular mechanism is needed for high resolution vision. And as we know, there's a region called the fovea that is responsible for a high visual acuity in the eye. So, what is this saccade mechanism actually does is it allows a 700 degrees to move within a second. It's a fastest motion. And what do you mean by ballistic nature is where the destination cannot be changed, but only the adjustments are made via a subsequent correctiveness. So it's like little by little, in a sort of a gradual way. It's so fast you don't even realize. At the same time, you've got to remember that there's some kind of a suppression that takes place. That the vision is briefly suppressed to prevent a blurred or a smeared image from what we perceive. And it's all about correction. It's all about being perfect. This saccade is of different types, like reflexive, visually guided, memory guided, predictive, and even the NH. So, what is reflective is where automatic orientation towards a new stimulus. Visually guided is like a simple redirection of gaze. Memory guided is where you remember a location and you are directed towards that. Predictive is to follow a target moving in a predictable pattern. And this anti is when intentional gaze shifts away from the stimulus. But if there are any abnormalities where it's supposed to be a faster response, but it can be slowed down. Hypokinetic disorders like Parkinson's disease. Or it can be inaccurate, like when you have a cerebral dysfunction, it can be over or undershooting target. Or it can be even impaired initiation where difficult to start or to stop. This can happen when the basal ganglia is affected in ADHD.